Welcome, I'm Erica Vargas,
And I'm Amanda Slevin.
and today we'll be talking about ergonomics. So, first of all, what is ergonomics? It is the design science that helps with the efficacy in the workplace. So, in dentistry, this means providing equipment and instruments that adapt to the operator's fingers, arms, neck, shoulders, back, legs, and even the eyes. Ergonomic applications are meant to increase comfort as well as the dental team works to keep pace with the dentistry's ever-growing challenges. In order to decrease work-related musculoskeletal disorders, dental professionals need to be aware of their posture while working.
So there's consequences of having bad ergonomics, and that's like fatigue, error, pain, discomfort, miss you get missed days at work, and also patient discomfort. And so bad ergonomics can result in carpal tunnel syndrome, ganglion cysts. Oh God, the curve decurrent disease. Oh, Ray in disease or white finger, and then there's trigger finger and tinnitus, tetanus elbow, and uh, rotator cuff.
And so there are some products out there that do help support having good ergonomics. A few of these products will include having wrist support. So this will consist of basically it's a wrap that you put around your wrist to help prevent wrist strain and help keep a straight wrist, and it helps to minimize carpal tunnel syndrome, which is a common syndrome that occurs with sustained wrist flexion with repetitive work, such as dental hygienists. So again, this wrist support, known as wrist timer, which is an elastic band, it's easily adjustable and helps to have a comfortable wrist compression. Other good products will include loops. So this is a big one in dental hygiene. So most students tend to have improvements with ergonomic posture with the use of loops, up to 82% of students. This will include areas of the trunk, head, and neck that were positively impacted through the use of loops. So these students and clinicians reported less pain in musculoskeletal muscles, less pain associated in those areas with the use of loops, because you're able to keep a correct posture and sit up straight and keep a safe distance instead of having to strain and look over at your patient. Another good product is different types of ultrasonic scalers. So there's different types of ultrasonic scalers, such as a magnetostrictive scaler, which will move an elliptical figure 8 pattern. There are varying different tips of surfaces, and with this tip, it makes it relatively easy to adapt to each side of each magnetostrictive scalar tip to a variety of tooth surfaces as well. With this technology, it essentially makes it easier for scaling for the clinician during a prophy and an SRP. And other good products are the dental chair. So that's really big with ergonomics. You got to have a good dental chair to be sitting in. Some clinicians are expected to use chairs without lumbar support. However, the body needs chairs designed to have with good lumbar support. So it's important to have a chair that has arm support because it helps also the clinician to neutral body posture because it can help obtain support. Without proper ergonomics, over time the chest muscles shortens while the back muscles will elongate, and this can result in a perpetual stoop and is characterized by rounded shoulders and a sunken chest and a head that juts forward. So this is an abnormal posture that over time with chronic use of having bad posture, your body tends to basically permanently develop into the wrong posture at all times, and it could be very painful and lead to many different complications. And another good another good product that is used for having good ergonomics is also basically just self-assessment. That's one of the best ways that you can help improve your own ergonomics is consciously being aware of how you're sitting throughout your treatments while you're treating your patients. Make sure that you're sitting up correctly. One of our case studies, there was a study in which they used a system called MDOPA, which is a photography system that helps to measure the different angles that each participant was in while treating patients. For example, a good posture to have would be for your head and neck, the front and back. It should be less than 20 degrees. So, really your head should still be sustained up straight while you're treating the patients instead of looking downward, which would be increasing to more than 20 degrees. And it's even very harmful if you're over 45 degrees, which doesn't seem like much and is probably pretty common between most students while they're trying to practice on their patients. So remember, good ergonomics is definitely where you want to be to increase your longevity for all dental clinicians.
And so there's treatment if you do have symptoms already showing or like preventative care. And so treatments are medication. Sometimes they use like NSAIDs, which help inflammation or pain that the patient or individual might be having. They also have stuff to help sleep due to body pains. And then so also treatment is exercise that includes muscle straightening and stretching, physical or occupational therapy. There's also acupuncture, relation biofed techniques, nice, osteopathic manipulation. There's that. There's therapeutic massages, surgery, and then there's also preventative so what you could do if you don't want any problems in the long run is just by doing good ergonomics, proper body mechanisms, proper lifting techniques, pre-shifting stretching and reverse stretching. So we hunch over a lot, so like putting your head back is a very good way to stretch out the muscles that you weren't using throughout the day. And then a good way to help increase recovery is like proper hydration, good nutrition, vitamins, supplements, proper sleeping habits, and good physical fitness. That will definitely help decrease fatigue and increase recovery, allowing our bodies to perform at the peak levels and prevent MSD from happening. And so there's so MSDs are a very serious thing. They could lead to many problems like we said earlier, tinnitus, tetanus.
Carpal tunnel syndrome.
Yeah.
Even tear to tendons, nerves, muscles. These things could lead to pain, aching, burning, stiffness, swelling, even limited range of joint motion permanently, which as dental hygienists, that's very valuable to us.
Yeah, and if you ignore the causes, the pain could turn into chronic pain, which could lead to more problems. And that's when you should look for over-the-counter medicine or just any help in general.
And the best way is preventative measures to prevent any of these musculoskeletal disorders in the first place. And by doing that is, by preventing that is the things that we have listed is by having the proper products such as use of loops. You want to have a correct dental chair. Again, the saddle is has great reports associated with it. Also, self-assessment, being properly self-aware of your positioning while you're treating your patients, and just by taking the correct steps, practical steps in design and arrange them in the workplace to make the work safe and efficient. With all the technology that we currently have, it really does help any dental professional to help keep and maintain our good ergonomics. Also, again, with the use of self-assessment.
Yeah.
So thank you for listening today.
Thank you. Bye.